Illness and suicide during Mental Health Awareness Week. In an op-ed in The Guardian, the singer and actress called on everyone to be a part of a, quote, new movement to fight the stigma around mental illness. Singer Selena Gomez has also been candid about her personal battles with anxiety and depression. The North Texas native has reportedly been hospitalized for mental health treatment. And joining us now is Dr. David Henderson, a Dallas psychiatrist and owner of Four Stones Collaborative Group. Dr. Henderson, thank you so much for joining us to discuss this important topic.
Absolutely.
So we're seeing celebrities being candid about their personal battles, everyday people also sharing their battles this week. How does that impact awareness?
Well, I think it's fantastic. I think the only way we get people to address the problem is by starting to talk about it and starting to develop solutions for how we deal with it. So I think celebrities that are willing to be vulnerable and open are doing tremendous work in getting that stigma reduced so that people can actually get help.
And that said, studies have found a link between social media use and symptoms of depression. Can you talk a little bit about that link?
Absolutely. I think there are two reasons why people get on social media. One is for active use. They have a specific purpose for why they're engaging other people in the social realm. And then there are other people that get on passively. They're bored. They don't know what to do. They feel lonely and isolated. And so they start scrolling through the feeds of other people trying to find some sort of encouragement. Those are actually the individuals who are at greatest risk of having social media affect them in a negative way with things like depression.
When might you know if it's time to take a break from social media?
Well, I think when you start feeling symptoms of depression, so if you're struggling to sleep at night, if you're starting to feel like your life doesn't have any meaning compared to the people that you're seeing on the screen, if you're feeling lonely and isolated and rather than calling a friend or getting together with someone for coffee, you're just getting online and distracting yourself, those are significant early evidences that you might start being, affected by what you're doing online.
And what are some of the symptoms that we should be looking out for in ourselves and our loved ones? And also, what may be some of the causes that trigger symptoms of depression?
I think there are four main triggers that lead people to get depressed. One is the issue of meaninglessness, which I mentioned. If you don't have any hope or meaning in your life, you're likely to get depressed. The other is the sense of isolation and loneliness. Choice is another effector of your mental health. And if you feel paralyzed by the choices that you have to make in your life, you're likely to fall into that despair. And then the last is the issue of loss, whether it's death of a loved one or loss of a relationship through divorce or a breakup, loss of a job, or even a dream. These are things that can really challenge someone's fortitude to be able to deal with the stresses of life.
And if anyone is recognizing these symptoms, we do encourage them to reach out and get help. Dr. Henderson, thank you so much for your time.
Thank you.